When facing a hip replacement, most patients focus entirely on the surgery date itself. They circle it on the calendar, but often overlook the logistics of the moment they walk back through their own front door. We collaborated with The Best of Health, the UK's trusted resource for over 50s navigating healthcare decisions, to analyze those first few hours at home. This quadrant chart maps your options. You can make high-impact, low-effort preparations before surgery, or you end up in the bottom right corner, scrambling to find equipment while in pain, which requires massive effort for very little impact. Standard home layouts expect you to easily bend, twist, and bear weight. After surgery, your new joint cannot safely tolerate those movements. Proactively equipping your home is a solvable logistical task. Ignoring it creates a severe, avoidable risk to your long-term independence. This anatomical diagram illustrates the core biological limitation of your recovery, the strict 90-degree rule. For the first 6 to 12 weeks, your healing tissues are highly vulnerable. Bending past this 90-degree angle creates a severe, immediate risk of physically dislocating the new joint. Adhering to that angle requires changes to how you sit down, how you wash, and how you put on your clothes. Attempting to use a low sofa or an unmodified toilet can result in an emergency hospital readmission for joint dislocation. Designing your home space around this biomechanical limit is the most effective way to ensure the joint stays in place while it heals. This timeline chart maps the progression of walking aids you will likely use over the first 12 weeks. Immediately after surgery, you begin with the Zimmer frame. The frame provides 4-point stability during the first 2 weeks when your leg muscles are at their weakest. By week 2, the chart updates. You transition to elbow clutches, allowing you to walk further and move faster while offloading weight. Moving into weeks 6 to 12, you transition to a walking stick. Your focus shifts from weight-bearing support toward regaining balance. It is tempting to drop the crutches early, but doing so increases your risk of a fall while your stabilizing muscles are still fatigued. Managing these tools effectively requires coordination, which is why committing to your early physical therapy exercises is essential. Strictly following this 12-week pacing prevents physical setbacks and allows your muscles to build strength at a natural pace. The bathroom is the primary hazard zone in your home. You are navigating low seating and slippery surfaces with compromised balance. This schematic compares a standard toilet with a raised seat. Adding those 4 to 6 inches keeps your hips safely above your knee, which prevents the joint from bending past the 90-degree danger zone. While clinical equipment can look out of place in a home, it serves as a necessary safeguard against dislocation during the first few months. You will also need to transition to seated washing. A shower stool or a bath board removes the need to stand in a wet environment. Sitting while you wash eliminates the fall hazard associated with standing on a wet surface with post-surgery balance issues. These bathroom modifications prioritize your physical safety over aesthetic preference during the recovery window. Outside the bathroom, you still need to bypass the bending restriction. This is done with daily living aids like long-handled reachers, extended shoehorns, and sock aids. These tools take a day or two to master, but they provide the immediate ability to get dressed without requiring assistance from a carer. This digital checklist tallies the cost of buying these items privately. When you account for the walking aids, bathroom modifications, and daily tools, the total cost sits between £150 and £300. The Best of Health research categorizes this £150 to £300 spend as a high-yield investment. It specifically helps prevent the trauma and costs associated with an emergency surgery to fix a dislocation. Most of this checklist is available from local pharmacies or online retailers, provided you source them before your surgery date. This financial input is the mechanism that secures your physical autonomy during a vulnerable recovery period. Hospital equipment provision varies by region, creating a postcode lottery that requires you to be vigilant about what you will actually receive. This matrix breaks down what NHS patients can expect. The left column shows the baseline. Walking frames and crutches are usually free upon discharge. The right column shows the gaps. You will often pay out of pocket for reachers, shoehorns, and raised toilet seats. For those having a private hip replacement, the rules change. Private hospitals rarely loan out home recovery equipment. Private patients are usually required to source and purchase the entire recovery checklist before their admission date. Whether you are an NHS or private patient, self-funding a portion of your recovery toolkit is a standard requirement for a safe home setup. Acquire and install every item on your checklist several weeks before your surgery date to ensure your home is ready for your return. Lacking a 10-pound reacher can have significant consequences. Bending down to pick up a dropped object is a common way patients accidentally dislocate their new joint. Taking control of the home environment provides a final layer of protection for the work your surgeon does in the operating theater. To see the complete pricing breakdowns and full mobility checklists, visit thebestofhealth.co.uk. Preparing your physical space in advance makes the first few weeks of recovery highly predictable, safe, and manageable.